Clark County public health officials are working to address the decrease in demand for vaccine appointments.
Elise Haas spoke with local health leaders about adapting to the slow pace of signups now.
Throughout Southwest Washington, the public health officer says that they've seen a drop in vaccination demand. And so that has made it harder for them to fill appointments at the mass vaccination clinics, but also at their smaller providers as well. What this tells public health officials is that we've just reached a different point in the vaccine rollout and a different population of people, and they're trying to meet their needs. So at the beginning of the vaccine rollout, they are reaching the elderly and the eager, the people who are willing to drive hundreds of miles and even hours to get a shot. Now that they've gotten through that population, he says they have a different, younger group of people to reach. And he thinks getting a shot needs to be made more convenient for them.
And I think for many of people in that group, they're not opposed to vaccines. It's just not a priority for them. So they're not going to go out of their way to make appointments. If any barrier that's put up is going to make it very difficult for those folks to get vaccinated.
To meet their needs of convenience and to break down barriers, throughout Southwest Washington, they're allowing walk-ins and drive-ins with no appointments needed. So that way people can come on their own time when it works for them. He says that alone has resulted in hundreds more people getting vaccinated. Plus, now doctors can offer it at a normal primary care checkup. And he says that's making a difference too, basically killing two birds with one stone. And they're also looking at making more vaccine sites at schools in an effort to also reach BIPOC communities who may not have as easy of a time getting to an appointment at one of these mass vaccination clinics. And Dr. Melnick says while the public health sector is doing its part to make shots even easier, he says that businesses and employers can also do their part to reduce barriers as well. It's important to remember that not everyone has robust paid time off, sick leave, or can afford to take unpaid time off to get their shot. Elise Haas, KOIN 6 News.